The Kintampo Health Research Centre, KHRC, was established in 1994 as a centre of excellence in research to influence high-level research both in the local community and the sub-region. It has over the years conducted research into diseases such as meningitis, malaria and other tropical diseases, non-communicable diseases and environmental safety, among others, that have informed decision-making in the Ghana Health Service. Known for its training programs and well-resourced laboratory, the Kintampo Health Research Centre also played a vital role in the Phase 2 and 3 clinical trials of the RTSS malaria vaccine, which is currently being piloted and implemented in some selected regions of Ghana. Over the years, KHRC has trained over 1,000 laboratory scientists for both the private and public health institutions in Ghana and beyond on standardized malaria diagnostic methods in private and public clinics and laboratories. KHRC has about 20 microscopists who are able to read malaria slide samples and outcomes to influence decision-making, standardization and quality control for study projects, prevention and control of malaria in the country.
Started this malaria work. It was basically one take film that we put on a slide. Now we see we have a take film and then a 10 film on the same slide. The take film is used for diagnosing the parasite. It concentrates the blood and makes it easier for you to be able to see if there's a parasite. But when the parasites are maybe more, you may need to use a 10 section or even to identify the species clearly. You need this part. So as time went on, we tried to, during our training, to train the lab scientists to prepare different things. And now I think if you go to almost every facility, they prepare different things on the same slide.
The director of the Kintampo Health Research Centre, Dr. Kintampo Asante, said though there are a number of proven malaria interventions, there is still more to do to eliminate malaria in the country completely.
Now everybody thinks that malaria is almost gone, but it's not. It's still there. So we just have to work hard at nailing it down. Our work in Accra shows that there are some places that malaria is less than 1%. But in other places it's as high as 10%. And so we also need to drill down to put in most of our effort in places where the burden of malaria is high, even in small areas, rather than at the regional level.
Dr. Puku Asante called for more investment in clinical trials in the country.
In the past, we had always received vaccines or medications that had been tested elsewhere and then registered by our regulatory authorities and then put on the market. But it's time for us as Africans, as Ghanaians, to be involved in clinical research to find solutions to our own health challenges. The other bit is to build infrastructural capacity for clinical research across the country, and that means that building high-level Phase 1 clinical trials, Phase 2 clinical trial centers to be able to develop these drugs as they come along.
The Kintampo Health Research Centre, KHRC, is one of the 3 health research centres under the Ghana Health Services Research Division, which is located in the Bono East region. For GBC News, Mavis of Kintampo reporting.